METs we did for the C spine. Only difference is now it's in the L spine and you can actually feel what's happening there. All right, so we already knew. Oh, thank you though. Appreciate that.
Jade! Oh.
That's okay.
Sorry.
All right, so we already identified with Angeli that it is for L2. Appreciate it, but I actually need a little bit lower. Thank you though. So that's the reason why it says on the slides to make sure they're on the table with their feet solid on the ground, because then you don't have to get crouched down like I am right now. Worst case scenario, OP scenario, just get a solid chair and do the things that are necessary. Okay. Oh, right. Okay. Assessment can be done on the chair. The MET needs to be done on the table.
That's right.
There's a reason for it.
So they can relax, lower back.
No, it has to do with the positioning of the therapist with the patient. So I'm gonna try my best for y'all to not get confused with this. So let's actually turn the table. So let's like so that you guys can see what both of us are doing. Okay, so Angeli, we're going to go ahead and demonstrate an MET process, first in flexion and then in extension. For these techniques, it is going to require me to place my hands not only around your low back area, but I'm going to get you to cross your arms across your chest, and my arm is going to be across your arms to help guide you through a variety of motions. Okay, purpose of this technique is to help restore facet function in your low back, or basically restore proper function in the joints of your low back. But there's a chance we might possibly create some discomfort with this technique, so if you experience discomfort, please let me know. But hopefully we'll be able to reset the function of your low back. Do you have any questions about what we're doing so far? Okay, perfect. I'm going to wash my hands, and then I will get you to please sit on the table facing that way for me. I gotta wash my hands. Good therapy.
Sometimes.
Thanks.
No, that's what you said last time.
I'm allowed to say that.
I'm kidding.
But you're right. I'm a good therapist. Excellent therapist.
I need. Yes. Do I need my legs?
Yes, you do. You do. Jade, can we borrow that one, please? You can have that. Yeah, you can have. Oh, I thank you. You can have that one though. I'm gonna be sitting on the table. Okay, that works too. All right. So we've already identified the segment that's affected with her. It's her L2. All right. In flexion, it was her right side. In extension, it was her left side. Was that it? I'm gonna recess. Go ahead and do a belly forward first, and then relax for a second. Good, and then go ahead and curl down. Keep going. Yeah, it's her right side in flexion and her left side in extension then. Okay, so we know her right side is her dysfunctional side, which means that she is going to be brought away, and away from the side of dysfunction. Okay? For her extension dysfunction, and this is where I don't want you guys to get confused.
Towards.
It's gonna be in the same direction, but she's gonna be doing extension, lateral flexion towards, rotation towards. Okay, so both flexion and extension of the same segment, you are gonna have your patient going towards the same direction. Okay, so right side flexion dysfunction, flexion, lateral flexion away, rotation away. If she had an extension dysfunction on the right side, then it would be extension towards. Okay? You with me so far? Good. Now, for therapist positioning, you are going to be, how's it going?
Hi, friend.
Right? So you're basically almost back to back with your patient.
Nice.
Almost. Therapist does not have to have their feet on the floor. I'm short, so that's good. Okay. So, the position we're going to be bringing our patient in, can I get your arms across your chest, please? Is going to be, and for boards, you want to make sure you have a pillow between you and your patient, obviously, always, for boundaries, etc., etc.
Is towel okay, or does it have to be?
Sorry?
For OP.
Articulate it to save you time.
Or towel.
Towel works.
Thank you. Maybe a thin pillow because this is a lot.
Yeah, this is.
That's okay. I would use a border. Or I could just do it without one. Okay, fine.
How clean that pillow is.
That is a good point. Okay. Sanitize your pillow if you're going to use any pillow. Maybe bring a towel from home. Thank you, Jade. I appreciate all the extra.
If you guys are with me, it's good to have a pillow cover because I don't want to see pillow.
Okay, yeah, sure. Make sure you appease Angelique and her cleanliness.
Towel's okay?
preferences.
Towel is fine, but you have to touch it.
There you
Okay. I draped her with a towel. All
I
right.
have OCD with bacteria.
Okay. Are we okay? Can I place my arms around you? Okay. I wash my hands. All right. So we've identified the site of our dysfunction. We're gonna find that's our T12. We're gonna come down. Maybe it slash just a little bit. Yeah. No, that's L1, and then L2. So it was L2. That was our landmark. Okay. So for this, I'm going to go ahead and find L2. I'm going to place my thumb actually between the two segments because my other hand is busy. Because I want to be able to feel when our target segment is moving, but the bottom one is not, right? So this is where that practice comes in.
So they're gonna be L2, L3?
Correct. Correct. So I'm going to get you to come up just a little bit. Good. And then we're going to do a slouch down. Go ahead, curling, 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 curling. Keep going, right there. I'm going to get you to laterally flex towards me. Good. Right there, good. And then rotate towards me. Keep going, right there. Good. All right, from here, I am going to now landmark on that TVP that is affected. Okay, so I just go straight over from that SP that I'm targeting. From here, I'm going to go ahead and landmark on the actual facet. Angelique, I'm going to get you to try and go in the 3 opposite directions. So gentle extend, gentle lateral flex, and gentle rotation, and hold for 5. I'm not letting her. 4, 3, 2, 1. Let go, breath in. And when she breathes out, I not only bring her further, and further, but my thumb is
going
doing,
deeper.
it's trying to like, have you ever seen those like pop top type bottles where you actually like push the lid back? It's that you're doing that, you're trying to force that facet open with it.
Okay.
Okay, so you're bringing them a little bit further, but you're also doing a push motion, like you're trying to open a stuck facet. Okay, so once we've done that, I'm gonna go back to my landmark. There it is. Once we've done that once, we're gonna do that again. We brought her a little bit further. Sorry, yes, Dina?
The block one is L3 or L2?
L2. But I wanted to see when L2 was moving, but not L3. So that's why I was between L2 and L3. So I can feel the top move, but the bottom not. Yes, Kurt?
Is that why you were saying stop?
Yes,
Okay.
correct. That's why I told her to stop moving because that segment has moved. All right, so again, we're gonna go a little bit. So I already brought her up in the, brought up the slack. So Angelique, I'll get you to do the 3 directions again. Lateral flexion away, rotation away, gentle extend. Hold for 5, 4, 3, 2, 1. Relax, breath in. And when she breathes out, we're gonna go further, and further. Again, my thumb is like, I'm trying to do that.
Trying
with
to
the
pop
facet.
it off.
Exactly. So we do that 3 to 5 times and then we reassess. So we did that a couple times. I'm gonna go ahead and assess. Yes, Oscar? When after she's breathed out, I'm like bringing her and pushing that over. Keep in mind, I'm not making her go immediately after she's done the contraction. I have her relax, breath in, and go further. All right, make sure you have that pause that happens in between. I'm gonna go ahead and reassess, see how we did. Good, and Angelique, I'll get you to go ahead and curl downwards for me, please. Now the right side's moving first. Great job, so we did great. We can also do that, even though that's the MET, for the purpose of effective treatment, you don't have to do it MET style, you can do it also as a mobilization. So I'm just gonna show you this. You are not gonna be tested on this. This is just for those of you who wanna utilize this. All right, so you're gonna landmark on the segment, right? Let's go ahead and flexion. Good, stop, and lateral flexion towards me. Stop, and rotation, there, stop. Good. So from here, you can actually get them landmark on the appropriate facet, and you're gonna bring them in all 3 directions at once while forcing it open, and you just basically go back and forth between the 2. So it's gonna be, ready? I'm gonna bring you into the motion, okay? Ready? And so you're going.
Ooh.
And going. You're
Nice.
trying to literally mobilize that facet. Yep.
Are you going back or are you doing the further?
No, with that one, it's a back and forth.
Back?
Yeah, with that one, I force it, bring it back, and then we force it again. So that one is a back and forth. Yeah. Now for extension. Now keep in mind her extension dysfunction was